مرحبا بكم، صحة شريبتكم. معكم نايلة من عيادة ليبوكلينك فرع دبي. هذه الحلقة الثانية من الفقرات الرمضانية تبعنا. اليوم ضيفنا دكتور يوآخم مünzberg، هو من مدينة دورتموند من ألمانيا، استشاري دكتور جراحة تجميل ومتخصص طبعا في المرض الليبيديما. Herzlich willkommen, Dr. Münzberg. Ramadan Kareem, welcome in Dubai.
It's nice to be here, and I'm very glad to tell something about lipedema, the disease and everything. So, welcome.
We have always the question when we deal with our patients, with their relatives, with insurances, that most of the time, despite the lipedema awarenesses we are all doing all over the world, still lipedema is considered as an aesthetic surgery. Can you explain why it's not
Yes, sure.
common?
So, lipedema is a disease. Unfortunately, a lot of doctors don't know anything about lipedema, and they tell the patients, please reduce your weight or make some sport and it helps. But the truth is, it's a disease and you can't do anything to improve it, but the only thing is to do a surgery. We can't make a diet or a gastric sleeve or whatever other procedures. It doesn't help. What we have to do is really a surgery in a special manner.
Dr. Münzberg, we have mostly all our patients, they wish they can do in one surgery and remove all the lipedema fats which are sitting in the arms, in the thighs, in the back thighs, in the lower legs. They wish they can do it in one surgery. Why it's not possible?
Yes. Unfortunately, it's not possible because we have to remove a lot of lipedema fat. So I will explain a little bit about the disease. So you have your skin. Under your skin, you have a layer of healthy fat cells. And then you have a big layer of the pathological fat cells called lipedema. And we have to remove all these lipedema fat cells. And sometimes this layer is more than 2, 3, or 4 centimeters. So you have to imagine, if you remove all this, you have already a huge layer and a huge wound area. So it's not possible to remove it in one session because we remove the fat cells and as well we lose some blood, and sometimes the blood loss is a little bit higher. It's not dangerous, but we have to care of it. But if you do all the operations in one, so the lower legs, upper legs, the arms, then it becomes light threatening. And this is not very good, so we have to do it step by step. Also for the patient, he feels much comfortable if we do it step by step and not he has everything treated in one case.
And can we combine, many ladies ask if during the lipedema surgery, as they are under partial anesthesia or full anesthesia, they would like to use the opportunity to fix something in their bodies, like their eyelids or their breast. Can we combine other procedures, aesthetic procedures, along with the lipedema surgery?
Yes. Fortunately, this is possible, so we can combine a liposuction with other lifting procedure or a blepharoplasty or a rhinoplasty. That's possible, or also a breast augmentation or lifting of the breast. This is possible. Also, sometimes it's not enough only to do a liposuction. Later on, most often after 6 months, we have to do also a lifting of the arms. So we make a combination. We start with the liposuction of the arms, then we go further on with the lower legs, and then when we do the front thighs, we can already start with the lifting of the arms. So this is a nice thing, and the patient don't lose so much time.
Yes, this is the goal. So mostly they wish to do many procedures in one. Definitely they have to come and meet you for the consultation to define what can be done and which procedures can be combined.
Yes. Also, I explain if is some lifting necessary or not. So the question is all the time in which stage the patient is right now. If he has a stage 1 or 2, most often there's no lifting necessary. If it's a stage 3 or 4, then I will explain after 6 months we need also a lifting of the thighs or of the arms. So it's depending of the stage and also of the quality of the skin. So,
Correct, yes.
So if we have young patients with a very good quality of skin, then we don't need any lifting.
One more question,
Please.
Which is very common. Can we transfer the fats in the hands or in some face or in other body parts after removing it from the lipedema?
That's a very good question, and most often the people are afraid when you take the lipedema fat and you put it in other places like the breast or the buttocks or whatever. We have a long period of experience, and we noticed that fortunately this pathological fat cells will change and they don't make all the symptoms like before. So you can put it in some other places where you want. So it's a nice thing.
Yeah, sounds good.
Yeah.
Then, as we are talking about the aesthetic, one more question. How about the backside, the back area, the buttocks area? Do you remove the fat radically in that area, or can the patient have a wish for a specific shape, or it should be removed in a radical way, or can we still shape the area and keep or transfer?
Well, we have two options. I will discuss with the patient what kind of shape he wants. Most often, especially in the buttocks area and the saddleback area, so this is only a small layer of pathological fat cells. If the patient want this nice shape like he had before, I remove only this small layer of pathological fat cells, and normally the patient doesn't see at all. So if she said, no, I want really straight, I don't like this shape, we can remove a little bit more, so also from the healthy fat cells, like I said before, and then it works very well, and all patients and also myself, we are content with the result.
So this means we treat the lipedema, we work on the medical part, and the aesthetic part is also included.
Yes, the medical part or the aesthetic part is also included. And sometimes also if somebody has the feeling that the skin doesn't shrink that very well, so I can go a little bit directly under the skin, and in this moment there will be a small inflammation, and this inflammation helps the skin to shrink, so we get an amazing result.
And this is what we see with you, with the cases when they come after a year. We see the amazing effect of shrinking. Most of them, they don't need the lifting procedure, which is a very nice result here. This is the holy month of Ramadan. It takes 30 days. Most of the women reflect in themselves and think about themselves as well, what they can change, how they deal with their bodies. Is it advisable to undergo the surgery during Ramadan?
Well, you can do the surgery, but you have to know that after the surgery you have a special loss of fluids, so you have to drink a lot, at least 4 to 5 liters a day. So that's very important. And so if you can deal with this, you can perform also a surgery during Ramadan. It's not a problem.
So Dr. Münzberg, after the surgery, because I do the surgery aftercare for the ladies 24 hours, I get the question always, when I will heal? When am I able to drive my car again? When can I swim? When can I go to the gym? Mostly the swelling is disturbing a lot our patients. So can you tell us good advices for the healing phases after the surgery?
Yes. So First of all, it's very important to wear the garments at least 6 weeks and 24 hours. So the patient should take off the garments only for take a shower, for the lymphatic massage, and then for washing the garments themselves. Very important is also to take some medication like ibuprofen, because it's not only for the pain, it's especially for the inflammation we have because of the surgery. So this helps a lot that the healing becomes faster. So I recommend really some medication. Also, you can drink a lot of lemon balm that helps against the swelling, and like I said, the lymphatic massage is very important.
It takes long time to decide whether to go for the surgery. It's not someone else's own decision in our culture. Mostly the family should approve it. The family members should say yes or no to it. Once the decision is made, how can the lady prepare herself very well for the surgery to have absolutely 100% successful surgery results?
Yes. So it's very important that the patient wears the garment 6 weeks before the operation, because sometimes tissue is very congested. So it helps a lot if she wear already the garments. It's like a soft massage. If the tissue is very congested, then I recommend also to start with lymphatic massage already 2 to 3 weeks before the operation. That helps a lot. And like I said, after the operation, it's really necessary for a good and fast healing.
Thank you, Dr. Münzberg, for being with us in our Ramadan show.
Thank you. I'm very happy to be here, and I'm really glad that I can help so many people here from this area. I'm really glad about it.
You are the most welcome. Thank you.
Thank you.
وهيك وصلنا لنهاية حلقتنا. شكرا على متابعتكم. نشوفكم المرة القادمة في الحلقة الثالثة مع الدكتور استشاري كمال المختص دكتور كريستيان بولس. تصبحوا على خير.